Good morning, everyone. We're so glad you could join us this morning. We're going to give everyone a few more minutes to get logged on before we get started. Thank you. Good morning, and thank you all for being on time. Let's give everyone just one extra minute before we kick things off. Thank you. Welcome, everyone, to Mary Center's first ever supporter virtual town hall. We are grateful for your making Mary Center part of your Friday morning this morning. While we wish we could be with all of you in person, we're thrilled to connect with you in this new and virtual way and to share Mary Center's updates. Before introducing our first speaker, I want to mention a few housekeeping items. Today's town hall will include a 15-minute question and answer session. We do ask that you please submit your questions via the chat feature, which you can find on the bottom menu bar. The questions will be routed to my colleague, Sarah Horowitz, and she will help manage the question flow. During the Q&A portion of the program, Sarah will read the questions out loud for everyone to hear, and then Todd or Maria will respond. Out of respect for everyone's time, we do plan to end promptly at 10:15. We will try to respond and help manage the question flow. We will, if there are questions that we don't get to due to time constraints, we will be in touch with you directly. We don't want any questions to go unanswered. Also, please note, today's session is being recorded and we will make the recording available to everyone early next week. Now, let's get on with it. I'm very excited to introduce our new chairman of the board, Todd Cox. Todd joined the Mary Center Board of Directors over 3 years ago. He brings a tremendous amount of experience, having been a former civil rights litigator and policy advocate. Todd is currently program director at Wellspring Philanthropic Fund. Todd, thank you for your leadership and your commitment to our communities. Everyone, please join me in welcoming Todd.
Thank you, Heather. We really appreciate the introduction. And I want to take this opportunity to welcome everyone to our very first virtual town hall. It is indeed an honor to be here, and it is indeed an honor to connect with you all. It's all the more important to do that in these uncertain times, and it's really important to do it even if we're doing it virtually. So we really do appreciate the opportunity to connect with all of you and all of our donors and supporters and stakeholders. Let me tell you a little bit about myself. Heather touched on a number of things. I'm a recovering civil rights lawyer. I like to say a lawyer by training. I started my career here in DC at the Department of Justice in the Civil Rights Division, worked at the Legal Defense Fund, NAACP Legal Defense Fund, the Lawyers Committee for Civil Rights, and also the Public Defender Service here, Public Defender Service for the District of Columbia, which focused a lot on civil rights issues and the criminal justice system. I then moved to New York, worked at the Ford Foundation, where I was eventually the Deputy Director of the Human Rights Unit, and then found my way back to DC to work for the Obama administration, and then eventually back into philanthropy, where I am now, as Heather mentioned, a program director at the Wellspring Philanthropic Fund, where I oversee our civil society program. Wellspring, Mary Center obviously is, like everyone, confronting a lot of challenges in this COVID-19 world. I want to talk to you a little bit about, before I get into the details about those challenges, why Mary Center was a priority for me and why I decided to join the board. Mary Center's mission and its focus, its vision for how it provides healthcare really spoke to me. Mary Center's social change model, which looks at people holistically, stakeholders and participants holistically, and really linking literacy, healthcare, education, and the like, and really understanding and appreciating that one's well-being and health is inextricably linked to those socioeconomic factors, really spoke to me, my background, my profession, as well as me personally. I'm a patient at Wellspring for Mary Center, as well as my children. In fact, my children were also at the public charter school that Mary Centers and BRIA partner with in DC. But COVID-19 definitely has been a blow, not only to this country and our community, but to our society as in general. Mary Center plays a critical role in making sure that those most vulnerable to the pandemic and most vulnerable to the ills of society in general are well taken care of. And those particular communities are often overlooked or ignored by government and other providers. So Mary Center's role generally is critical in that space, but also particularly during the pandemic is critically important, because often those communities are disproportionately impacted by the pandemic. However, COVID-19 has not changed Mary Center's mission, its goal, or how it delivers those services, and the goal being to provide top-notch medical care to those despite their ability to pay. Nevertheless, as I alluded to before, the pandemic has ushered in a new normal, or perhaps a new abnormal for all of us, including Mary Center. So Mary Center staff and Mary Center itself finds itself giving that top-notch medical care, that top-notch providing that care through its social change model, but also deploying all of that within the context of new protocols and procedures to ensure the safety of staff, as well as providers, as well as participants and patients. Like all of you, or many of you, Mary Center staff may find themselves providing that care at home, doing it remotely, while they also are donning this sort of dual or triple role of being a school educator, in-home school educator, or depending on the age of your child, here in the summertime, a summer camp coordinator here at home. Those challenges are not unique to Mary Center, they're acute. But Mary Center is uniquely positioned and uniquely able to respond and thrive despite those challenges. As board members, we are here to support Mary Center and make sure that Mary Center is able to continue to provide the top-notch medical care that it can despite these challenges. That said, we can't do any of that without the support and partnership that you all provide. So we're enormously grateful that you're here today, but also enormously grateful for your partnership and your ongoing support and help during the pandemic, but and always for Mary Center. At this point, I'd like to introduce Maria Nunez Perea. Maria is a graduate of our teen program. She graduated high school in 2020. Our teen program here at Mary Center provides friendship opportunities, mentorship opportunities, as well as support for school, after school at the center. We're very proud to say that Maria is going to attend the University of District of Columbia in September. So I want to thank Maria for spending time today to share her experiences with Mary Center. She and her mother have been participants for some time now. I'll turn it over to Maria. Thank you.
Thank you. Good morning, everyone. My name is Maria Nunez Pereira, and I recently graduated from Paul International High School and was a student in Mary Center's teen program for the last 2 years. Prior to joining the teen program, I had been coming to Mary Center for medical care for several years. I joined the teen program during my junior year of high school after my friend suggested it to me. Through the teen program, I participated in various types of workshops that helped me with school and my personal health. I was able to participate in workshops such as mental health, workshops, drug prevention, safe sex, and resume writing. Connie and Katia, who led the teen program, were such a great support system for me. They were always able to find resources for me when it came to me dealing with anxiety and depression when I felt like I couldn't do it by myself. It was helpful for me to be able to go to Connie and Katia when I was having a hard time. They would give me tips on how to de-escalate my anxiety when I was going through a panic attack. The teen program also had a major impact on my college plans. As a dreamer and first-generation high school graduate, the college application process was tough. I had been struggling on figuring out how I was going to pay for my education due to the fact that I couldn't receive help like my fellow classmates did. Connie and Katia would sit with me during the teen program and help me find scholarships that were specific for my status and would help me apply to colleges. I'm excited to share that I will be attending the University of District of Columbia next month and will be majoring in psychology and pursuing my career in the mental health field. The teen program has made me feel more optimistic about people and organizations that want to help minorities succeed in this society. As a minority myself, I was taught that it was hard for minorities to succeed due to our status in society, which made me feeling unmotivated about going to college. After being in a teen program and seeing how much they were willing to help me and other students that were also minorities changed my whole perspective. Overall, I just want to thank the teen program for making me and every student feel like they had people in their corner willing to help and making the teen program a safe space for everyone. I know it's not only me that is grateful for the teen program, but every single student that has participated and is participating now. Once again, thank you for helping me grow throughout these 2 years within the program. Thank you.
Thank you, Maria, for sharing the small impact that Mary Center, truly a small impact that Mary Center has had on your already tremendously successful life. Please, we want you to know to always count on Mary Center as your home base, Maria, for you and your family from now on. Thank you. Good morning, everyone. Thank you for joining us this morning and for letting us into your life through the Zoom experience. As this week wraps, this is probably like, how many Zooms have you had already, right? So I feel very privileged this morning to have your attention on this beautiful Friday morning. So thank you so much for being with us. I think we have over 60 people present this morning, and I think that's just, I feel so loved. The love is received tremendously. I want to also express my deepest gratitude for extending the life preserver and the different ways that each and every one of you out there has done for the last 6 months. Your Lifeline has preserved 750 jobs, have kept 750 jobs intact at Mary Center. It has kept our doors open even more and phone lines open for over 60,000 of our participants when they needed us most. All the while, some of you probably have had COVID yourselves, and even more devastating, you probably have lost loved ones to this wicked virus, this extremely wicked virus. Thank you for continuing to think of your neighbors, even when you were overcome with fear, with depression and loneliness. May health and joy always reign over you and all your loved ones. As you may know from the quarterly updates you received from us, our participants have been significantly affected by COVID-19 also. I want to provide just a glance at the trend of this virus has had in our community and how it affects individuals. So Sarah, can you please give us the slides? Okay, so the first slide we have here is on the y-axis. You will see the number of visits that people have had, and this was just for testing. The red lines are all the people that are positive. The green are the ones that are negative. So as you can see, we had a tremendous peak. The peak was in April and May, throughout May, and it stayed through June, and it sort of stabilized and gone down tremendously this last few weeks. But I wanted to say to you that this is actually probably a false picture in many ways, in that we also have had to bring down the number of tests just so that we can bring in more patients for their chronic disease. School is starting, so we've had to bring kids for their immunizations. Pregnant women are desperately wanting to come in more frequently for their care. So we've had to bring in more of our patients, and we've decreased the number of testing in the last few weeks, and last few months, actually the last 2 months. So as you can see, how the red, all the positives, that peak in April and May, and then now decreasing. So the next slide. Okay, a little bit about our sort of trends in regards to the gender and the age. As you can see from this slide here, we've tested over close to 3,000 individuals, and this is only the data I think through May, if I understand. You'll see that on the left side are the females, right side is males, and it stands to reason that Mary Center sees quite a bit more females anyway. But in general, you'll see here that on the y-axis, what we see here on the y-axis is the age of people, and you can see, if you look at the red areas on both the male and female, that the greatest positives are in the ages of between 20 and 50 years of age, but the peak is around that 30 to 40 years of age for positives. And so this in general is saying that also that about 30 to 35% of the population that we see, if we adjust for the number of people, males and females, that about 30 to 35% of the people that we test are positive for the COVID. Next. Then we took the trend by race and by ethnicity. And so we probably gave you a lot more information that we needed to give you, but just to summarize it here, the top over here, the gray top, is that of 2,200, almost 2,300 tests, there were 13% of African Americans are testing positive for COVID. You see also that we have quite a bit of trouble really getting our community to identify in terms of race. And so we know that most people who don't report tend to be either immigrants or Afro-Americans. And so in that unreported piece that you see there, we probably have a very large number of Afro Americans and Hispanics, and also immigrants from all over the world. Then on the bottom, you'll see that again, for ethnicity, we have about 37% of the Latinos who test positive for COVID. And then 13% of the general population test positive for COVID. Next. And then the last slide we have is, this is a stark slide that I think, and this is only like about 1/4 of the population of pregnant women that we have at Mary Center. And we see that that of just 101 of the women that tested, who were uninsured, who did not have any insurance, 50% of them tested positive for COVID. And you will see that in that uninsured population is usually the people that are in living arrangements that are very, very crowded. And so it tends to, we tend to see a lot of pregnant women as we're testing more and more. And throughout the region, we have meetings of obstetricians that look at this results quarterly, and they are really themselves just really surprised of how many of the immigrant women are also testing positive, pregnant women that are testing positive for COVID. And then of Medicaid population, almost 40% of the Medicaid population is testing for COVID. Again, this goes to the whole idea that this is a population also that sometimes lives in very crowded homes. And then that you test that with how many people in the commercial side, people like you and I, who go out there and get tested. Only about 25% of the population is tested positive for COVID. So I just thought it would be, I thought it was really important for us to give you sort of an update of what it is that we have in our community. So thank you so much, Sarah, for that. In addition, I wanted to just tell you that not only is the physical health, the trauma that people have, but emotionally, the pandemic has also taken a heavy toll on our participants. The job losses and wage cuts have led to food and housing insecurity. We know that unemployment among Latinos and Afro-Americans peaked at 18.5 and 16.2 respectively in April. This was just in April, so at the peak of this, we had that many people out of jobs compared to 12.8% in the rest of the population. Immigrants who didn't receive stimulus packages are struggling and continue to struggle. We continue to have a virtual school that is making it very, very difficult for our students from under-resourced families who may not have the technology that they need to access the lessons and the therapists that they need to connect with Mary Center. Our school kids practically lost, and as I talk to more and more parents, they practically lost over 3 months of education this past spring because they did not have access to internet. So I want to give a shout out right now to Comcast, PNC Bank, and Walmart, because Mary Center was able to purchase and distribute more than 200 Chromebooks for our families who had no access to technology, keeping these few children connected to virtual learning and important telehealth visits to attend to their therapy and other health needs in their families. You know, in talking to one of our participants just last week, as I come to work every day and tour all the sites and talk to people and talk to patients and talk to neighbors, I was talking to a patient of ours who was crying inconsolable while describing how few of her belongings and that of her 3-year-old were scattered all over the streets. Her and her husband were exactly 52 days behind in the rent, and because it was an informal living arrangement, they felt they had no recourse. They both were laid off for 4.5 months and are now back to only 50% time. But the beauty of the story is even more touching to me. that as this family was going through this tragedy, they told me that they both chose to job share with other co-workers so that they could live together and care for each other's children when at work. In addition, I was totally overwhelmed when the mother, inconsolable, was telling me that she was so happy. She was so overwhelmed when she got the cash assistance that many of you helped happen, because it helped her pay the taxes. They told me that they're so committed to doing everything right. For the privilege of becoming a USA citizen someday. For the privilege of becoming a USA citizen someday, they are trying to do everything right. And your support helped them pay the taxes so that they could do everything right. I myself feel very and deeply confident and supported by your friendship and commitment to each one of you during this period. You have poured so much kindness in so many ways, by providing in-kind protective personal equipment, especially in the early months when there was a worldwide shortage. Many of you came through with masks and gloves and everything to help us stay healthy and to stay safe. Cloth masks were brought by the hundreds to make sure that our participants were also protected, both at home and at work. Many employers were demanding that if people did not bring their own mask, they could not have a job. Financial contributions also have enabled us to stay in the fight. And it's a fight every day. We were able to expand our telehealth program to ensure that COVID-19 did not prevent our participants from accessing medical, behavioral health, and even dental health. We now have brought up dental health fully, and we hope to restore it completely with this beautiful, beautiful dental health unit in Montgomery County. Practically the month that we opened it, COVID hit in March. Your assistance also helped us ramp up testing efforts. For instance, on March 13th, we were able to put up tents for symptomatic testing, and also at the same time open up for regular visits for pregnant women and our chronically ill patients. Your financial contributions in the work of the Greater Washington Community Foundation also helped us set up direct cash assistance, as I just mentioned with the family I talked about. And now also we're gonna have money for homeless and other excluded workers that are not immigrants. That is a tremendous lifeline. Thank you, because we will be burying our loved participants, not of COVID, but because of hunger and depression. So we want to thank you for that cash assistance. You've assisted childcare providers to maintain their home business open so they can be safe themselves and they can keep children safe, but also continuing to support families out in the communities so that people like you and I can go back to work. And last but not least, many of you have helped to make sure that our frontline workers, starting in March, were able to get more nutritious food. I was so impressed and overwhelmed. When I saw boxes of this beautifully prepared food come into our centers every day, and all so that our staff could be well nourished every day. And you should have seen the teary-eyed providers who were just overwhelmed by your love, putting their life at risk was something that was devastating for their children, their loved ones. But coming to work and seeing how much love you provided was amazing. So thank you. You know, this pandemic is not over. It's not over in so many ways, both the health piece, but also just we're dreading what will happen to the market soon and what that will mean to the funding for all the programs at Mary Center. So early on, we had to shut down 2 sites, but they're all back up again. We're back up again, immunizing children and making sure that medically compromised individuals are getting the care in their home. We're doing home visits through telemedicine to make sure that our fragile elderly are getting the care that they need, that they're getting not only the medical, but that they're getting the social interaction that they need to see. We have so many elderly that have been neglected, not because their families so much have neglected them, but because their families can't visit them. And maybe some of you are in that situation. And so you understand deeply what that means. So we have also returned and are ready to return to the schools and are ready, have returned actually to talk to our teachers and prepare to do mental health in the schools when the kids are at home and the teachers are needing all the help that they can get. So we are there to both support our teachers, the parents, and the kids in this new learning environment. And we're working very, very, very deep with all of our politicians, both our mayor here in our city and all of the politicians in Prince George's and Montgomery County, to make sure that they can open safely, to make sure that we can test, to make sure that we can do contact tracing, and to make sure that we can help isolate the people that we need to isolate with all the services that the public sector has for that community to be able to stay safe. And so how can you help? You can help by continuing to do what you have been doing, by introducing us to more of your friends, by advocating that to make sure that the stimulus package gets out of Congress and gets out into the community so that we can continue to get, we have not, Mary Center has been one of the organizations that has not been able to get the PPP, the People Protected Income that's coming to organizations that are smaller than 500 people to keep people employed. We have kept everyone employed through all the help that you have given us and through all the means that we had prior to COVID. But we desperately need for the rest of the year, we need that money to get out of Congress. And to hopefully that money will be available for organizations that are 500 and above employees. We need you to continue to advocate to make sure that the city and the counties, there's no reason in today's time that every person that cannot afford internet can get internet. Our children are going to be totally devastated if they cannot connect to their schoolwork. They've already lost 3 months of schoolwork in the spring. And we want you to register, please, for Gala. Virtually, it's going to be fun. We want to see you there. We want to see your faces. And we want you to please, please vote on November 3rd. Get out and vote. Thank you.
Thank you, Maria. We're going to go ahead and take some questions that have been submitted in the chat. Let me just get through them. So one of the questions that was asked is how many pregnant patients were tested? I'm going to unmute you, Maria.
So the slide that I showed, there was a little bit over 100, but I think we're like over 350 now. And the trend continues to be that half of the people that we test are positive.
Okay.
Pregnant women that we test are positive. And that stands to reason. I think one of the reasons that we think that is true is because our pregnant women are the ones that are living in much more crowded conditions.
Okay, thank you. We had some questions that were submitted before the event, so I'm going to read those aloud. How are you renewing the spirit and health of yourselves and frontline workers? Maria, I'm going to unmute you. I'm sorry.
Oh, you probably will say not. I'm not doing a very good job, am I? I'm taking off next week. But I think in terms of the staff, I think staying connected virtually has been amazing. I think that we have been able to talk about some of these issues. I think that some of the issues that are happening in our country as it relates to anti-Blackness, how we treat, how we've been treating our Afro-American community for so long is an opportunity. It's been an opportunity. It's been a great venue for us to talk about this, to hire somebody back in the beginning of the year to work with us on this issue and to really dig deep in our own community about that issue and to talk about what it is to be Black working in a predominantly immigrant community, what it is to be an immigrant living in a country that predominantly dominates with English and privilege in many ways. What it is to work under scarcity, right? So all these conversations are happening. We are encouraging people, even though we need people desperately, we encourage people to please take time off, even if you can just stay home or just make it a week where you do nothing at all whatsoever, but encouraging people to take time off, and then just making sure that people recognize that their jobs are secure. That's so important because we have so many people at Mary Center whose partners have been laid off, completely laid off, and are still laid off. So I think those are some of the things that we're doing to keep people's spirits up right now. So if anybody in the audience has other ideas, I'd love to hear them. And we're eager to do things a little different while continuing to maintain, our stability financially, which is not easy.
Thank you. We did receive a comment in the chat that asked if we could talk about the partnerships with local government to highlight needs and bring services to those in need during COVID. I don't know if you want to give a little more information about that, Maria.
So some of us have been part of the mayors and the executive, what is it called in Maryland? The executive branch over there that we've been part of the meetings to reopen Prince George's, to reopen Montgomery County, and to reopen the district. And those have been really great because our voice has been heard. We're really pushing, and we would love for every one of you to write to the mayor, to write to Leggett, and to write to Allsbrooks, both of them in Prince George's and then in Montgomery County, to please make internet accessible everywhere. Not just in libraries and schools, but publicly, so that people can have access to internet. This is something that we've been asking desperately. One of the things that we're trying to do now is to make sure that they put more money into testing. We need to test as many people as possible, and we need to make sure that they get the results as fast as possible. But we also need to make sure that they have enough money to do contact tracing, Because once we test somebody and we ask somebody, who do you live with? And they say, I live in a household of 10 people. We need to do contact tracing with those individuals, and we need to make sure that we get them the help to isolate and to make sure that they get healthy.
Thank you. I think we can do 2 more questions. And Heather, you might be able to chime in on this one. Have previous foundation funders to Mary Center been more or less supportive during this pandemic?
Absolutely more supportive. Our foundation community has really opened up their wide arms and given us a huge hug and financially supported us. We are extremely grateful to the foundation community and the individuals and the corporate community. So thank you very, very much. And we hope to continue to keep in touch and share with everybody what our impact has been.
I also wanted to just mention and to say that, you know, for all of you, I don't know if everybody in this call knows who the DC Primary Care Association, but they're the umbrella association of Mary Center as a federally qualified health center, and they've been tremendously helpful in just keeping us moving and just making sure that we do the excellent work, that we keep up on our quality care, but also supporting us through this whole process to make sure that our staff stays well. They have committees of like the HR committee and the nursing committee and different program committees so that our groups can talk to all the other health centers related programs, so whether it's nursing, medicine, you know, HR, finance, and also making sure that the Medicaid, which is our payer that keeps us alive, continues to increase in this moments of crisis. And DC Primary Care Association has been crucial to make sure that the Medicaid is now giving us an increase for a little bit of increase in the Medicaid rate during this pandemic. And we hope that it can last throughout the end of the year. So we're very grateful to them.
I think we have time for one more question, and this is about advocacy. Regarding advocacy for the next stimulus package, which specific requests or needs are at the top of Mary Center's list?
So, for the package, I think and I know that the National Association of Community Health Centers has also been such an amazing advocate. But right now, the PPP, if somebody can remind me again what that stands for, but the money that pays for the people that we employ, that is crucial, and the emphasis is on organizations that employ 500 people and above, because all the other PPP that has come about, all the other stimulus package that people have been able to apply for has been for organizations that have 500 and less employees. And that's great. My counterparts that are that size, and I'm just so blessed that they have that money. So that's one thing. And then the other is to make sure that stimulus package continues to pay for telemedicine. Telemedicine is really, really, really going to be very important. And if there's room for the states to do to make sure that they can use the money, I would say to you that internet for everyone. You know, I always say that I'm willing to pay twice as much for my internet so that everyone can have internet, you know? So those are the 3 things that I would just say. And anyone in this meeting that can put in chat or that has other things that they want to ask for, but those are, to us, those are golden to us.
Thank you, Maria. I think that's all the time we have for questions. If we didn't get to your question, we'll make sure to reach out to you individually.
Yes, and thank you for your questions. And please, we also want to continue to hear from all of you. So please feel free to reach out at any time. I want to thank Todd, Maria, and Maria for your time this morning. And of course, I want to thank every one of you for joining us today. We really, really appreciate your spending part of your morning with us. moreover, we are incredibly grateful to all of you for the incredible support throughout this public crisis that you've provided to us. It's because of our dedicated supporters that we can stay in this fight against the virus and help keep our community members healthy. We appreciate the question from somebody about how they can support Mary Center. Our website is always a great way, www.marycenter.org. And lastly, as Maria mentioned, please be sure to put our gala date on your calendar, Friday, October 16th at 7:00 p.m. And you can also register for free for the gala at our website as well. And thank you so much for joining us, and have a great weekend.
And I just wanted to say, I don't want to leave without saying for everyone to look at who our board members are, look them up. And I just want to say thank you so much from the bottom of my heart to each and every one of our board members and all of our supporters that have been with us for so long. I see, I just was able to look at the chat, and I see old friends like Betty Paw and other people that have been in our lives for so long. Thank you so much for being in our lives for so long. And thank you to the board for all the support and all that you do to make sure that Mary Center gets alive, and for all the intelligence that you bring every month when we meet to make sure that we stay on top and that we stay number one. So thank you.
Thank you, everybody. Have a great rest of your Friday.
Thank you.